So I, Dr. Varun Ahuja, I welcome you all to today's webinar, Cervical Pain and Correlation with Calf and Hamstring. So let us start. What do we know about cervical pain? Let us start in an interactive way. Suppose a patient visits doctor's OPD. Doctor, yes, tell me what happened. Patient, sir, मुझे cervical है. And doctor like me checking my cervical spine. भाई मुझे भी तो है cervical, मेरा कोई गुम थोड़ी ना हो गया. So this is a very common term. Patient will come to your OPD. Patient will say कि sir मुझे cervical है. And irrespective कि वो किस वजह से हो रहा है, एक बहुत कॉमन टर्म हो चुके हैं आज की मार्केट में, आज के एरा में, कि सर मुझे सर्वाइकल है. So what exactly is cervical pain? Cervical pain or neck pain is a common condition that can result from various factors including poor posture, muscle strain, injury, locked facets, or degenerative changes in the cervical spine. While neck pain primarily occurs because of the upper part of the body, it can be due to tension on the other areas, including the lower body, especially the calf and hamstring muscle. जिसकी वजह से आज का हमने वेबिनार ऑर्गेनाइज किया है. I have seen many of my patients, they complain of cervical pain, and after visiting so many different OPDs, so many different doctors, when they come to me and when I ask what treatment do you get in other OPDs, they said कि सर यहीं पे अल्ट्रासोनिक टेंस इस एरिया पे कर दिया, यहाँ पे मुझे स्ट्रेचिंग बता दी. बट द मेन फोकस इस वेबिनार का जिसके लिए हमने ऑर्गेनाइज किया है टू मेक यू ऑल थिंक दैट व्हाट इज द कनेक्शन बिटवीन योर tight hamstring or your tight calf and cervical pain. Coming on to prevalence, globally 16.7 to 75% people face cervical pain once in their lifetime, and annual prevalence is 30 to 50% in adults. Coming on to age, earlier it was more common in 40 to 60 age group, but that number has come down to 32 to 45 in last decade due to more sitting jobs and increased screen time. तो आज के वेबिनार में वी विल बी टॉकिंग अबाउट दोज पेशेंट, दोज केसेस जो हमारे 32 टू 45 की कैटेगरी में हैं, जिसमें हम डीजनरेटिव कंडीशंस के अलावा पोस्चरल कंडीशन और मोस्टली हमारा जो सिटिंग प्रोफाइल बढ़ गया है, बिकॉज आज की डेट में सबसे ज्यादा जो कॉर्पोरेट जॉब्स वाले हैं वो इस पेन से सफर कर रहे हैं. व्हेनेवर वी टॉक अबाउट सर्वाइकल पेन, फर्स्ट थिंग दैट कम टू आवर माइंड इज ओके डेस्क जॉब होगा, ओके पानी कम पी रहे होंगे, बट उसका इम्प्लीकेशन क्या है और हम उसमें कैसे अपना रोल प्ले कर सकते हैं. दिस वेबिनार इज बेसिकली बिकॉज ऑफ दिस. इन द लास्ट 1 or 2 months मैंने कई सारे ऐसे केसेस देखे हैं अपने ओपीडी में, जिसकी वजह से मुझे लगा कि इस पे एक वेबिनार करना चाहिए. मेनी पीपल कम टू आवर ओपीडी एंड दे कंप्लेन कि सर हमने यहाँ ट्रीटमेंट करवाया, हमारी नेक पे काम हुआ, कुछ टाइम तक दर्द सही रहता है, फिर वो पेन वापस आ जाता है. When we talk about prevalence also, occupation, neck pain is particularly prevalent in certain occupations, especially those involving prolonged static posture. We are lucky हमारा जो occupation है that does not involve sitting continuously. We have very mobile lifestyle, and those having repetitive movement or poor ergonomic, office worker, healthcare professional, drivers, and individual in manual labor jobs often report higher rates of neck pain. I'm not talking about mechanical pain here. इस webinar में will be more of talking about postural pain. Now, prevalence in office worker, जिसके बारे में आज हम सबसे ज्यादा बात करेंगे. Among office worker, particularly those who spend long hours at a computer, prevalence of neck pain can be quite high, with studies indicating that 42% to 69% of office workers may experience neck pain at some point. So this patient was suffering from cervical pain and had session with several physiotherapists who worked on her trapezius, retractor, and pecs. When she came to us at the physios, we started working on her lower extremity, and without even touching upper body, pain got cured. I want to play this video, so just listen this testimonial.
Just skills and data. I work with Boston Consulting, but an administrative assistant. If I talk about my pain, it is because of a horror film. I've had pain in the entire body. It started with somewhere here in my shoulder, went down to the entire left side, shifted bit to the right side, then went entirely on the left foot and the left limbs. Suffered for a very long time, kept crying, couldn't really find the solution. Then eventually came to the physios, met the doctor here, and Dr. Varun was able to treat it through my foot. I actually very, very, surprised. Even something touching my knees and my foot, and the pain here on my shoulders getting resolved. First time when he was doing it, I was like, what is he doing? Where is this going to take? He's just wasting my time and money. One more session here. But when eventually I had a session with him and he did something in the neck and it helped her in the shoulder, it is one of the most long lasting impacts that I've had for approximately one and a half months. Came back to it for a second seating and I actually feel relieved. I'm here today to visit him again with no session and just say this to you. So must visit.
Thank you. So this is a normal testimonial that we received. Basically, what happened was when she came to me, I just asked, "What is your daily lifestyle?" And she told me that sitting job बहुत ज़्यादा है, ऑफिस में काम करते हैं, although environment बहुत अच्छा है, तो लैपटॉप पे बैठे रहते हैं, and her posture is just like a normal corporate office worker. When I asked कि lifestyle कैसा है, कुछ stretching वगैरह involve नहीं, चलना ज़्यादा है और बाकी सेटिंग का ही जॉब है, पानी का इनटेक इनका 2 से 3 लीटर था. So when she said she has been through a lot of physiotherapists and she took sessions for her cervical pain, one of the doctors said that there is some problem in her scapula, that's why she is facing this pain. Lenny's test, but there was not any problem in her scapula. Instead, she was facing pain because of her tight facial line that we are going to discuss in this webinar. So now let's discuss correlation between cervical pain and calf and hamstring. But before that, fascia. Do you remember fascia? See, we have had a lot of webinars related to fascia, and fortunately, this is also one of the webinars that belongs to this category only. So, talking about fascia, fascia is a thin casing of connective tissue that surrounds and holds every organ, blood vessel, bone, nerve fiber, and muscle in place. Here you can see, जो भी मसल होती है, मसल के ऊपर एक बहुत पतली सी कवरिंग होती है. जो फोर्स ट्रांसमिशन होता है या फिर जिस एंगल पे फोर्स को ट्रांसमिट करना है, वो सारा काम फेशिया का होता है. फेशिया एक्चुअली ट्रांसफर्स योर एनर्जी फ्रॉम योर लोअर बॉडी टू हायर बॉडी and from the epicenter to the peripheral area. Fascia is the only structure which connects your tongue to your toe. But the structure which connects your tongue to your toe can be culprit as well. From tongue to toes, what's holding you together can also hold you back. So this is basically the posterior superficial facial line that we'll be talking about. Many of you who might have attended my previous webinars, आप सबको पता होगा that we have already discussed about posterior superficial facial line, and it starts from your plantar fascia, then it goes to gastrocnemius. In standing position, it is one single line, whereas in sitting position, it gets converted into two different segments. So plantar fascia, gastrocnemius, hamstring, erector spinae, cranial fascia, and it goes to your eyebrows. So this is the area जो transfer करता है. Now what actually happens is, let us understand the biomechanics कि exactly हो क्या रहा है. In any sitting position, you can see calf और hamstring ये दोनों बहुत shortened position में है. तो यहाँ पे जो fascia है वो tight हो गया. उस फेशिया के टाइट होने की वजह से ऊपर जो पेरास्पाइनल का फेशिया है उस एरिया में एक टेंशन डेवलप हुआ. इट इज सिमिलरली लाइक यू आर सिटिंग and someone from the posterior side is pulling you down like this and you're working like this. So all the load comes to your shoulder and you are connected by cervical spine between your head and your shoulder and upper torso. तो जो सर्वाइकल स्पाइन का सेगमेंट है वहां पे मसल काफी छोटी होती है जिसकी वजह से सबसे ज्यादा लोड उस पॉइंट पे आता है. इस फोटो में आप इजीली देख सकते हैं द एंगल बिटवीन योर फीमर एंड टिबिया. जो आपका नी है, नी कितना ज्यादा फ्लेक्स्ड है. नी फ्लेक्शन का काम होता है हैमस्ट्रिंग का. सो हैमस्ट्रिंग बेसिकली शॉर्ट एंड पोजीशन में है। आप एंकल की तरफ देखेंगे तो एंकल आपका प्लांटर फ्लेक्शन में है, दैट मींस के काफ भी शॉर्ट एंड पोजीशन में है। सो अलोंग विद काफ, अलोंग विद हैमस्ट्रिंग, ये दोनों शॉर्ट एंड पोजीशन में होने की वजह से फेशिया को पुल कर रहे हैं, जिसकी वजह से पेल्विस के ऊपर का जो सेगमेंट है, जो आपका अपर बैक और टॉर्सो है, वहां पे फेशियल टेंशन ज्यादा बढ़ जाती है। उस टेंशन की वजह से लोड पड़ता है डायरेक्ट आपके सर्वाइकल स्पाइन पे। वी हैव सीन अ लॉट ऑफ पेशेंट्स जो आपके पास सर्वाइकल पेन लेके आते हैं जिसमें टेंडरनेस का ग्रेड 4 होता है, ग्रेड 3 या ग्रेड 4। उस टाइम पे व्हाट वी डू, वी डोंट टारगेट दिस एरिया, इस एरिया को, क्योंकि जो मसल ऑलरेडी स्पाज्म में है, जो जहां पे टेंडरनेस का ग्रेड 3 या ग्रेड 4 है, वहां पे अगर आप टच भी करोगे तो टच करने से और ज्यादा स्पाज्म जो है इंक्रीज होगा। वी यूजुअली आस्क पेशेंट, ओके जस्ट गो फॉर आइसिंग और टेंस लगा दो, अल्ट्रासाउंड कर दो। उसके बदले व्हाट वी डू, we ask the patient to lie down in supine position, comfortable position, and we start stretching its calf and hams. हम पूरी posterior facial line को जो है stretch करते हैं। Here you can see this is your superficial back line. Left side पे अगर आप देखेंगे fascia is evenly distributed, जो कि आपका ऑरेंज कलर से आपको दिखेगा, और राइट साइड पे आप देखोगे ग्रीन कलर से, इसमें आपको दिखेगा फेशिया जो है बहुत ज्यादा इवनली डिस्ट्रीब्यूटेड नहीं है। नीचे जो है वहां पे फेशियल टाइटनेस है, ऊपर फेशियल टेंशन ज्यादा बढ़ी हुई है। व्हेन हैमस्ट्रिंग एंड काफ गेट्स टाइटेंड अप, myofascial tension arise in paraspinal area and cervical area, and cervical area is equipped with dense network of nociceptor as compared to your lower extremity. इसलिए सबसे पहले जो पेन आपको ट्रिगर होता है वो आपका सर्वाइकल एरिया पे होता है, irrespective of the tension in hamstring and gastrocnemius. Although if you are more of athlete and you have any strength game or any flexibility game, there are chances कि आपका hamstring pull हो या calf pull हो because of this tension. But if we talk about corporate worker or any worker जिसमें ergonomics काफी ज्यादा affected होती है, उस केस में सबसे पहले ट्रिगर cervical spine होता है। Myofascial release of lower segment of superficial back line leads to generation of hyaluronic acid, which reduces tension amongst facial line, ultimately reducing tension from the cervical area. अब इसमें what we actually do, we try to develop more and more of hyaluronic acid. जिन लोगों ने workshops attend किए हैं हमारी द फिजियोस की या फिर webinar attend किए हैं, मैं starting से एक ही बात कहता हूँ, why do we release? देयर हैव बीन अ थ्योरी कि अगर आप 1 टन का भी फोर्स लगाते हो तो उससे फेशिया डिफॉर्म नहीं होती। हमें फेशिया डिफॉर्म नहीं करनी, वी जस्ट वांट के डिफरेंट लेयर ऑफ फेशिया के बीच में hyaluronic acid जो है उसकी कंसिस्टेंसी बढ़ जाए, एंड दिस hyaluronic acid gets released because of friction and mechanical pressure. So whenever we release, whenever we press and move, उस एरिया पे फेशिया के बीच में hyaluronic acid रिलीज होता है, जिसकी वजह से वो टेंशन जो है वो खत्म होती है। क्योंकि अगर हैमस्ट्रिंग और गैस्ट्रोनेमियस की फेशिया एक दूसरे के ऊपर ग्लाइड करना स्टार्ट करेगी तो दैट विल डिक्रीज द टेंशन इन द फेशिया ऑफ इरेक्टर स्पाइनी, thereby decreasing the complete tension of your upper torso, और उससे आपका जो सर्वाइकल स्पाइन है उस पे से लोड रिड्यूस होगा, और लोड रिड्यूस होगा तो आप डायरेक्ट कॉज पे काम करोगे जिसकी वजह से सर्वाइकल पेन आ रहा है। We have been saying this for quite a long time कि अगर किसी घर में आग लगी हुई है और अलार्म बज रहा है, don't focus on that alarm because pain is nothing but your body, it is a way of asking कि यहाँ पे कुछ इशू है और उस पे फोकस कीजिए। So in the same way, this webinar के through, we just want to convey this message कि try to link as much as my facial segments as possible. So with these words, I would like to end this webinar, and this topic is over. And one more thing that we would like to launch in this webinar is that very soon we'll be starting case series discussion with the physios. In this would be a panel discussion, or इसमें we will ask students, not any professionals, to be a part of this conversation. We will ask students, we will provide a case 1 week ahead, and that case will be circulated with all the interested participants, और उसमें हम कुछ panelists select करेंगे जो कि आप लोग ही खुद को nominate करेंगे, and we'll give you dates कि किस webinar में आप आना चाहते हैं वो पूछ के, और उसमें we will ask our young students to come up and to discuss कि उनके मन में क्या है. And please, I would request everyone, don't hesitate, because अगर आपको कुछ नहीं आता, अगर आपको किसी चीज की नॉलेज नहीं है, तो उसमें आपकी गलती नहीं है. But if you continue to persist that, that is your mistake. With these words, I, Dr. Varun Ahuja, would like to sign off. And if any doubts, they are most welcome. Yes, Harpriti ji, this webinar is almost over because my students know कि 15 से 20 मिनट के ही webinar हम organize करते हैं. I don't want people to get bored. Just मुद्दे की बात करो, and that is it. That's why people come and join. So I would request you to join this webinar on time, because we just have this 15 to 20-minute session. We deliver talk, we take doubts, and that is it. We don't continue for almost an hour. Thank you, Shivam. Thank you, Neha. I would like to receive things from you कि आप लोग किस केस को बहुत ज्यादा देखते हो, किस में बहुत ज्यादा फंसते हो. Last time we discussed sciatica कि sciatica में क्या hamstring का रोल है, sciatica में क्या piriformis का रोल है, and this time we have come up with cervical pain because lots and lots and lots of patients, they are suffering from cervical pain. Many of you guys might be having cervical pain, so just lie down and just stretch your calf and hams and you will see the result. And I'm not talking about all the degenerative cases. डिजेनरेटिव केसेस की मैं बात नहीं कर रहा हूँ, क्योंकि उसमें सर्वाइकल पेन किसी और रीजन से भी आ सकता है. एंड आई एम नॉट सेइंग कि सर्वाइकल पेन का ओनली यही रीजन है, बट दिस इज अ वेरी सिग्निफिकेंट कंट्रीब्यूटिंग फैक्टर. सो all those people who are seeing patient, all those doctors, just try to implement this thing in your OPDs, and we will give good result to patient. I will share the link of webinar of sciatica. Just do message me on my WhatsApp. Sir, can you explain to assess either it is fascia or the muscle imbalance in neck for cervical pain? Hi Sajan, how are you? Nice that you are joining this webinar. And it is very simple. Just ask the patient to lie down in prone position, and just try to release hams and just give a quick release for hams and calf. If you see any difference in pain, suppose the pain was 8 and it goes down to 7, that means that somewhere the fascia is involved. Muscular imbalance, I know that you can easily assess, but if it is regarding fascia, just try to go and release hamstring, calf and glutes, and if the pain on NPRS it goes down, then we are on the right track. And in 5 minutes, we will give the review link in this chat, and you can fill that, and in 15 days, you can receive your certificate. If anyone has any doubt, you can text me or you can unmute yourself and say, sir, how can I join future webinars? Just do drop me a message on WhatsApp. I'll add you to the webinars group, and you will get notification, mail, message, everything. How often fascia gets involved in pain? Well, it depends upon your posture, it depends upon your work, it depends on your ergonomics. And see, it is myofascia. Fascia is the covering of your muscle. If you move your muscle, fascia gets involved. If you don't move muscle, fascia gets involved. The only thing is that if you drink enough water, then there are chances that your fascia is non-sticky and is a good fascia. And if your fascia, if you don't drink good amount of water, then what happens is your fascia gets tightened up. Hi Gifty, you will receive your certificate on email only. Hi sweetie, if someone have no resting pain, but due to driving he got intense pain or computer job. See, it again depends on muscular weakness. अगर आपको किसी पोजीशन में पेन आ रहा है, तो आप ये देखो उस पोजीशन पे हो क्या रहा है. अगर ड्राइविंग में पेन आ रहा है, तो व्हाट आई थिंक नेक फ्लेक्सर और नेक एक्सटेंसर इतने स्ट्रांग नहीं है कि वो हेलमेट का लोड बेयर करें. Go for you can go for EMG. Physio has got very good EMG. You can go for that, or you can do MMT for that. Very simple thing. So everything depends upon ruling out things. जितना आप डिफरेंशियल डायग्नोज करोगे चीजों को, उतना अच्छा है. इट डज नॉट मीन कि सर्वाइकल पेन है तो आप बस फेशिया को रिलीज कर दो. आपको ये देखना पड़ेगा कि उसमें नेक के सराउंडिंग मसल्स जो है वो कैसी हैं. Is there any PDF to be shared? What PDF you exactly want? Regarding facial lines, you can download book, or you can just drop me a hi on WhatsApp and I'll send you the things. But exactly क्या चाहिए वो please आप mention कीजिएगा. Anatomy trains. Tom Mayer's की है Anatomy Trains. That is a good book. You should read. That is very significant for your practice. बाकी एवरीवन हैज देयर ऑन थॉट. तो मैं ये रिकमेंड करूंगा कि बुक कुछ भी पढ़ो, स्टार्ट विजुअलाइजिंग. जितना आप चीजों को विजुअलाइज करोगे उतना आपके लिए बेटर रहेगा. या इट्स माय प्लेजर दैट यू आर जॉइनिंग फ्रॉम घाना and do I wish that you will join us in our future webinars as well. Do drop me a message and I'll definitely help you as much as I can do. Yeah, hi Ashish. You're most welcome. And the future webinars, can the elasticity of the superficial backline be improved? Definitely, we can improve. Definitely. What we actually do for improving the flexibility of, you can say, superficial facial posterior line, what we do, we just ask patient to get into hydrotherapy and we put a noodle beneath the ankle. So what happens that the patient is standing and his hams and calf are getting stretched with the help of buoyancy. So we do it in that way. You can do myofascial cupping, you can do stretching, you can do gentle myofascial release. Anything can work. See, once you have diagnosed that the facial line is tight, you're a physiotherapist, you can do it. I just said कि आपको केवल उस एरिया का hyaluronic acid बढ़ाना है and the thing will get solved. There is no big thing. Most important thing is assessment. 99% is assessment, 1% is treatment. अगर आपको पता है आपको करना क्या है, you will have n number of ways. And if you still get stuck somewhere, I'm always available on WhatsApp. Just drop me a message regarding your case and I'll definitely help you out. Yes, today's meeting, this will be uploaded on my YouTube channel, and then you can have a look on this. One thing I would like to say is that very soon we'll be opening case series and all. See, why I do this webinar is I love response from all of you. So whoever wants to be a part of any discussion, suppose we'll share you the case and definitely I'll share YouTube link channel. Suppose we share case and you think that this case is interesting and you have something to some good input to give, then I would love that you please be a panelist, and please don't overthink that you will be judged here, because this is a channel where you will not be judged. This is not a channel for your professional. This is a channel of students, by students, and for the students. I have been a student. I have faced a lot of things. I, along with my partner, Dr. Suraj, we have worked upon them, and now we want to give you guys a platform where you can come up and where you can speak or whatever you think. There won't be any judgment on you. So just come, just open up your heart, open up your mind, do brainstorming, because what I actually feel is there is a lack of brainstorming in physios. Just do a lot of brainstorming, and that's how we'll uplift the profession. That's how we will help patients in a different way. So very soon we'll be sharing up the case, and I think it will, they all will be atypical cases. I'll not share normal cases. We'll share something different. So just try to take interest, do join our webinars, and just wait, I'll just share the review link, because a lot of people are waiting for that. So I have shared the review form link, and it is 7:29. This will be valid till 7:40. Anyone who has any problem in filling up this link, they can directly message me on my WhatsApp, and we will not be accepting responses after 7:40. So it was my pleasure meeting you all after such a long time, and hopefully we'll get in touch again and again and again. So with these words, I would like to sign off. If anyone has any doubt, you can say right now, or you can text me later, DM me later, and I guess it is for the evening. Thank you so much. Yeah, okay. Bye, Sergeant. Bye, everyone. Thank you.